A public health advocate who fought for needle exchange in Massachusetts has died. Tim Purington was a former city councilor in Holyoke and helped begin needle exchange programs in Northampton, Holyoke, and most recently, Springfield. Purington had retired from Tapestry Health, which runs the local programs, in 2017. I sat down with Holyoke Mayor Alex Morse and Liz Whynott, the director of harm reduction at Tapestry Health, who shared stories about Purington's work and needle exchange programs.
I first met Tim, I was actually a junior in high school at Holyoke High School, and I was doing some organizing in the LGBT community, planning a youth pride prom. And I met Tim. He was elected to the city council, I think the first openly gay city councilor in Ward 4. And he started coming to the planning meetings for the pride prom, and we built a relationship and a bond. And fast forward to after I graduated from high school, my first internship was working at Tapestry Health, where Tim had worked for many years in public health and harm reduction. And I ended up doing an internship with the Among Men, For Men program on Bay Street in Springfield. And that was sort of a continuation of Tim and I's relationship. And as the years passed, I graduated from college, I ran for mayor. Tim was a great friend and ally. And I took office in January 2012, and Tim and I had already had conversations about the need for a needle exchange program in the city of Holyoke. He, as a councilor, had been advocating for it the 4 years prior. And just as a public health advocate for decades before, his history in the city of Northampton and in Western Mass in general lend itself to have these conversations in the city of Holyoke. We had the third highest rate of HIV and hepatitis C via IV drug use in the city of Holyoke. And the data and the evidence clearly showed that a harm reduction program, a needle exchange program in particular, would certainly make a dramatic dent in those statistics. And so we worked very quickly with the Board of Health in the city of Holyoke and implemented a program in the city.
And I know that he had worked, as he had mentioned, for years on needle exchange. There's a new program in Springfield recently as well. Tell us a little bit about your experience with him.
Well, so I've been working at Tapestry for about 10 years or so, and I started out at the Northampton Needle Exchange under Tim's leadership. And at that time, the Northampton Needle Exchange was the only one in existence west of Boston. There were only 4 that were open at that point. And that Northampton one opened up in 1995. Tim had started working at Tapestry pretty shortly before then, so he was involved in opening the first one in Northampton. And then between 1995 and 2012, when the Holyoke one opened, there weren't any that were successful because needle exchange has always been so political, and it's really it should be looked at as a public health issue, but because it's been looked kind of in the politics, it's been turned into a moral issue, especially within the 90s and the early 2000s, when Tim advocated quite a lot for the need for needle exchange in the state. So when we opened the one in 2012, that was really a turning point. And there was a lot that happened after it opened. Members of the City Council in Holyoke actually filed a lawsuit around how it was opened and the approval process. And that lawsuit lasted for about 4 years. And basically what it ultimately resulted in is that I think that brought up a lot of opportunity for discussion around needle exchange and what it is and why it's so important. And in 2016, I believe, 4 years after the Holyoke program opened, the law changed a little bit, which basically ultimately made it much easier for other needle exchanges in the state to open. So again, Holyoke was the 5th needle exchange to open up in the entire state in 2012, and now in 2019, there's well over 20. The most recent one that we opened a couple months ago is in Springfield, and the discussion around needing a needle exchange in Springfield has been going on for about 25 years, and Tim was at the center of a lot of those efforts. Tapestry wouldn't be where it is today without him.
How effective are these needle exchange programs? Because I know that there was a lot of controversy in Holyoke, but across the country, and you take the moral part out of it. From a practical standpoint, people will say, hey, listen, somebody's coming to you who has a problem, and now you're giving them a clean needle and really sort of encouraging or saying it's okay to keep using. And that's not really a moral statement. That's sort of a practical statement of, is this something that is a good way to discourage, a habit, that can kill you?
Yeah, it's not just about the practicability, it's about public health and saving lives, right? So not just public health work, but I took an oath of office to protect the people of the city of Holyoke, right? And so when you look at those statistics and that data, it's a harm reduction program. And so it may not be the first time that they walk through the needle exchange program that they, choose to go to a detox and get into treatment, and maybe the 25th time or the 100th time that they go to the program. I mean, the facts speak for themselves. I mean, more needles have been collected than have been distributed by Tapestry as an entry point for potential treatment and rehabilitation. And it's also, wouldn't you want your loved one? I mean, I certainly want the same for mine when they're affected by this disease and they're not getting help, that when they do choose to get that help, that they are free of HIV or hepatitis C.
And the rates have gone down?
And rates have gone down. And, the work of Tapestry and Holyoke in particular with overdose prevention trainings, Narcan trainings, we're one of the only communities in Western Mass that has seen sort of a stabilizing of overdose death rates in the city. And I think it's because of our intense focus on public health and making sure it's as accessible as possible. And I think for a lot of folks and most folks have someone in their life that has been closely impacted by addiction and substance abuse, and oftentimes it's much easier to understand the need for these programs when you've been personally impacted by it. Mm-hmm. And the stories, not just in my family, but the stories of the folks over the last 8 years that I've met in Holyoke that have been impacted by the program and by this disease, it's crystal clear that we should be supporting these programs. And as Liz said, I'm very proud of the fact that because of Tim's leadership, not only were we able to do it in Holyoke, but we've opened the doors for 20 other programs over the last 6 years as well.
Does it make it sort of like Holyoke or Springfield or any other place that has one of these programs sort of an attractive place for people to go? I know that has been one of the criticisms that people came up with as well.
Attractive place in what
as
sense?
far as, okay, well, now we can go to Holyoke to get a clean needle. Does it sort of encourage the drug use?
No, I mean, it doesn't really change the incentives whatsoever, right? So, I mean, it's a harm reduction program. So folks who, they're either going to use a clean needle or they're going to use a dirty needle, right? And so the program is to make sure it's there to promote public health.
And again, there's a wealth of evidence that do show that needle exchanges don't have an impact on the amount of discarded syringes. Is that if anything, they decrease them, that they make people more likely to access treatment, and there's just decrease in HIV and hepatitis C. But it just really took that passion and leadership to stand up and say, okay, we are gonna deal with this. We're gonna bring it out in the open, and we're gonna help these people.
Yeah, and I would say it wasn't the intention of the program. It's been certainly a consequence of the program that we have fewer needles in our public spaces, in our parks, and on our streets because of this program. We've analyzed the crime data in the neighborhoods of the needle exchange program at the request of the city councilors, that we're hoping to make a point that the needle exchange program somehow leads to drastic increases in crime, which are just ways, the issues around morality and politics around public health. And none of those data suggested that there was a correlation between the opening of a needle exchange program and increased theft or crime in that neighborhood. On the contrary, our citywide public safety strategies have led to a historic decrease in crime over the last 6 years at the very time, and for the first time in our history, that we've had a needle exchange program in operation.